good afternoon. Hope you've had a nice lunch. It's my great privilege to be director of Well North, and it was put in place to cut across the diagnostic, the therapeutic and service boundaries, to bridge the knowing-doing gap. Professor Jacobs convinced the Chief Executive of Public Health England to invest at least £9 million, matched locally across the corridor of the North, to do three things: to improve the health of the poorest fastest, to reduce premature mortality, and to reduce worklessness. 60% of those who are unemployed have a health-related illness. The stats are quite extraordinary in terms of, it's amazing how many conferences you go to and people talk about health inequalities, and yet the gap is widening. It's widening. The life expectancy gap between Bradford and Guildford is 19 years. Absolutely extraordinary. And a girl born in Manchester today will have 15 years less good health than a girl born in Richmond in London today. There's something really wrong when we've got to that stage. A lot of it is about reaching and engaging the population. Martin Luther King said very famously, of all the forms of inequality, social injustice in health is the most shocking and inhumane. I'm a doctor. I can't believe at times that we don't reach those people who most need us. And it isn't a question of funding. It's a question of understanding the lives they lead. I get out and about a lot with health visitors and nursing staff and policemen. I recently came across a woman. She was a very ordinary, hard-working person, lovely young family. And we just got into a conversation. She forgot herself for a moment, and she said, when I get up in the mornings, I vomit at times. Not because I'm pregnant or because I've eaten something that didn't agree with me, but because of the day I face into. She cleans other people's toilets. She feels total despair. She cannot see any hope. These people have no hope. When I sit down with health visitors and I ask them, it takes them about 40 minutes to get used to someone wearing a tie. And you talk to them and you say, well, look, what you deal with all the chronic conditions that account for 70% of our NHS budget. What is it you see when you go into underprivileged communities? What do you see in terms of health? And they say, well, if we're honest, what we see is debt, over 70%. Domestic violence, over 70%. And the worst of it is the opposite of the L'Oreal ad. People just don't feel worth it. They don't feel worth the fact that they should have good care, and they're hugely loyal to a system that doesn't deliver for them. In many of these places, we see no grandmothers over the age of 60, and we see teenage funerals. My job, our job in Well North, based in MAHSC, in Manchester, is to go where no one else will go, to say what's unacceptable and to show how it's fixed. And that won't be down to us doctors or us nurses or us policemen. We need to deprofessionalise the solution and demedicalise it. That's the only way we can begin to engage with these communities. So what we do is we make the invisible visible. At the moment, there's more than 5 million people with undiagnosed hypertension, more than 500,000 undiagnosed diabetes. When we get them, we can do extraordinary things with our technology. What's really critical for us is to get the angle of entry right with these individuals. And that's about developing a team, a multiple agency team of policemen, of nurses, of doctors, of teachers, of social workers, of so many people that engage with the community, that is meaningful to the patient groups that we're dealing with, that is relevant, that is connected, that generates confidence, that builds and earns trust and deep support. Trust is absolutely critical. So we're forming those teams at the moment, and we're recruiting based on compassion. Very hard thing to recruit that. but we work with people for many weeks before we look at them. And we've no shortage of people who are volunteering. They get fully paid, of course, but they do volunteer for these teams because people out there are more worried about debt and domestic violence and don't think they're worth it. And to build engagement with them, to reach them and engage with them, is a real challenge. Part of our methodology is to identify the sites, and we're doing that very clinically and very academically in an added value way. But beyond that, we're working with a technique called familiar strangers. So actually, when we can't find these invisible thousands, we go to postmen, policemen, housing officers, refuse collectors, food bank officers, lollipop ladies, hairdressers, taxi drivers, dinner ladies. And we find the most extraordinary thing. They can tell us where these patients we need to reach are. What we do is we offer them services wrapped around them as opposed to them coming into our hospitals. We wrap the services around the patient. And beyond that, we identify among their number leaders, influencers, people who will buy and be bought by other people. I work with the homeless in London, and we have found that we needed to employ homeless people to engage with homeless people because they were the only ones they trusted. We are now finding in the communities across the north there are individuals without degrees, without academic qualifications or credentials, who have more influence among their community than any of us could ever hope to have. We will take them and working with the military, not with bayonets and bullets, but developing individuals' capability to be resilient. Resilient means, I was at home yesterday doing something at the dining room and the Christmas tree was up and my wife had put a lot of effort into it with the kids and at one point it was like one hand clapping, the Christmas tree just fell over completely. I mean, can you imagine? The lights twinkling, baubles crashing, and I'm the only one in the room, so I must be to blame, but I never moved, I wasn't near it. What I should have done was put my head in my hands and wept because it shouldn't have happened. It was the wrong thing to have gone. But actually, I smiled. I was quite resilient. Worst things have happened to me in my life than the Christmas tree falling over unexpectedly. But what we find in these communities are that these seemingly small things crack people's personality and their resistance. I saw a cleaner recently in one of these areas who walked into a house to do some cleaning. She just burst into tears. There'd been a party that expected her to clean up, and she was going back to a house where she wasn't going to have a meal and look after children who were starving, and she just felt she'd reached the limit. She'd lost her hope. It's our great gift and privilege to be able to initiate Well North in this way and to build in the best anti-poverty intervention we can, which is to build resilience among the community so that we can get patients active in their own care. More than 70% of chronic conditions are down to individual lifestyles and behaviours. It's a real privilege to be able to talk about that here today, and I'm going to introduce now the Manchester Schools Alliance, who on the 17th of November came together, 6 schools, and in a remarkably inspirational way, have developed this diorama, this play, directed by the wonderful Sarah Woods, and with script from many of the schools, to express from their point of view how they see their future and their health. I give you the Manchester Schools Alliance. Thank you.